Hi, Dr. Pelto here. Going to go over this. It says, do not try the Bible method for ganglion cysts. This was a recent post we did on ganglion cysts for our office and our blog. But let me go a little bit about ganglion cysts and tell you about this Bible method. So a ganglion cyst is a cyst that happens usually on the foot. That's where I treat it, but it can happen other places in your body. And as you can imagine, one of the treatment options, you take a big book and you whack the heck out of the cyst and pop it. But I don't always recommend it. What causes a cyst? Well, it can come from a joint or it can come from a tendon sheath. This is not an example of a cyst. This is a bone spur, so it can be misdiagnosed for a bone spur, and it can come over a joint or it can come from a tendon sheath. And it can also be a bone spur if you're misdiagnosed it. A mucoid cyst is usually seen on a toe. We're not talking about a mucoid cyst, but it's a little outpoaching in the digit, usually at a joint. There's a distal joint, which is like this one, and then there's a other joint down here. Usually happens at the distal joint down here. And you can try popping that, and it tends to come back pretty frequently. The diagnostic exam, the best one I find is doing an ultrasound where I drain the fluid. It kind of looks like hair gel. I know everyone's using the paste, but this one, back when I was a kid and I had more hair, I used to use hair gel. And this is what it kind of looks like when you pull it out of a joint or of an area. And what I recommend doing is when you pull it out, then you wrap it. Okay. What else can it be? Everyone asks, what else can it be? Well, it could be blood, which is a hematoma. This is an example of a patient when I popped it, blood came out. It could be a fibroma, which is a little micro tear of the plantar fascia or the fibrous band. So it's not a ganglion. It could be a tumor, which is just a growth, or it could be gout. So it could be other types of things. That's why you should see a professional. What are the treatment options? You can do the book therapy, which I don't recommend, which is popping it on your own. We do the same thing as a doctor, though. We really just take a needle and we pop it. And what we try to do, here's an example of the book therapy. I love this picture I found online, especially with the skull in the back. But what we try to do is we try to pop the thing and then let it shrink down. So taking a grape and making it a raisin. So the whole goal is very similar if you have a balloon. If you like when we have my kids, what they do is they fill up a balloon and then they empty it. They fill it, then they empty it. And every time they empty it, it sticks to itself. So that's the whole goal is you fill it up and empty it, it fills up and then you empty it, and eventually it'll stick to itself. So this lining will stick to itself and it won't fill up again. So besides popping it, I also recommend using some Coban around it. So wrapping it tight, so compression. Okay. And then surgery, sometimes we do remove it. There's a high chance of recurrence, but this is an example of a ganglion cyst removed. I always tend, when I remove them, I always tend to pop the darn things, and it's kind of frustrating because you can get all this cyst stuff, and yet it's hard to find where the base is. But occasionally, if it's too big or if it's near a nerve or something that's really causing pain, you'll have to remove it. Here is my little treatment evaluator. I'm going to put another video to ganglion cysts if you want to learn more about this. There are different types of resources as well. I'm going to put underneath this video on Amazon if you need the stuff, to the wraps and the Coban, and to get the right stuff. I'll put a little link to my stuff on Amazon there. What I find most effective is aspiration, which is removing it, and then you can reduce the pain, reduce the size, and advanced treatment. So to reduce the pain, you aspirate it to make it smaller so it's not aggravating a nerve or aggravating in your shoe. Sometimes we can do cortisone. Usually just pulling out the liquid's enough, but cortisone can sometimes make it cause to stick to itself a little bit better or shrink down. Anti-inflammatories and icing, they're not going to really resolve the cyst. They're just going to make it feel a little bit better. The same thing with the topical creams, CBDs, BioFreeze, Voltaren gel. To make it get smaller, aspiration is the best thing. And then compression is so it doesn't fill back up again. How long do you have to compress it afterwards? I say a week or two after you pull out the liquid, and you can't compress it for the rest of your life. And then advanced treatments would be removing the cyst. And then if it's in a toe, sometimes we have to fuse the toe so that joint doesn't fill back up again. I'm going to show some other videos on the side here about ganglion cysts if you want to learn more. If you have any questions, please post a question. That's how I get my fodder for these videos. If you like it, please subscribe to the channel and let me know.